everyone. So the video that you're going to be seeing from now on, this was a presentation that I had to do for a couples group for my church, and I thought it was a very interesting conversation and an interesting lesson that even us as nursing students or as future professionals, we also need to be aware of, we also need to be learning. So I thought it would be interesting for you guys to be able to see this presentation. Anyway, let me focus on doing this presentation. Good evening, everyone. My name is Silibaziso Mupereki. I'm a registered nurse by profession and also a young wife. And in today's session, we're going to be discussing about what we call silent killers in health. Then we're also going to be discussing how the people that we live with, especially our partners, play a big influence on our health and whether we reach our health goals or not. And then I'll be drawing my knowledge obviously from my own research, but also from the interactions that I've had with my patients in a hospital setup, and also from inspirational couples that I've interacted with personally, and also the 2 minutes that I have been married. And then I'll just be combining all of that knowledge to inspire you guys as you take an active role in taking care of your health. So in today's session, we're pretty much going to be covering what are silent killers in health, what and how illnesses are directly caused or influenced by our partners, how to reach our health goals with the help of our partners, and also just a call to action for us to take an active role in our health. So in health, there is usually 3 chronic conditions that we call silent killers. And the reason why we call these chronic conditions silent killers is in most cases, people do not have symptoms. And some people, when they find out that they are affected by these chronic conditions, it's usually at a later stage. And now when we're intervening, it's like big interventions that we're doing, because in most cases, these illnesses do not show symptoms. However, they do play a big role in our health. And these silent killers is diabetes, hypertension, and hypercholestremia, or high cholesterol levels. So first off, I will start with diabetes. So this is when a condition when your body can't properly use or produce insulin, causing blood sugar levels to rise. So naturally, our bodies are going to have a high sugar level when we have eaten or when you're busy doing physical activity, because your body needs the sugar, or what we call glucose, in our bodies to be able to do bodily functions. However, when these blood sugar levels are consistently high, they cause problems in our bodies. So there's 2 types of diabetes. We've got type 1, which is an autoimmune disease. This is when your pancreas doesn't make enough insulin, and this usually starts in early adolescence and in your teenage years. Then type 2 is the most common type of diabetes that we find, and this is usually linked to poor diet, inactivity, overweight, and genetics. Then there's also the 3rd type, which is gestational diabetes, and usually this happens during pregnancy and can affect both and mom if uncontrolled. So the big player in diabetes is insulin. So your body can either be not producing enough insulin, or it is unable to use insulin. So what is the use of insulin? So insulin is what tells your blood glucose level to come out of your blood or your circulatory system and to go into your cells. So for our cells to function, so cells make up our body organs. So when blood glucose moves to the cells, that is the only way that your body is able to function. So for example, let's say you eat an energy bar. That energy bar is converted into glucose, and that glucose goes from your digestive system, your stomach, intestines, etc. It is absorbed into the body and it goes into your bloodstream. Then from your bloodstream, it needs to go into your body cells. So these cells can be cells in your muscles, this can be cells in your heart organs, etc. And your body is only able to use this glucose when it is in the cells and not when it is in the bloodstream. So yes, it can be used when it is in the bloodstream, when it is moving from one place to the next, but glucose, we mostly want it to be in your cells because that is the way that your body functions. So obviously, when the pancreas, which is the body organ that produces insulin, if it is not functioning correctly, whether it's not producing enough insulin, or it's not using insulin properly, or it is unable to use the insulin, that is when we have a problem and we have diabetes. So here are some symptoms that you can have when you're diabetic, but the easiest and the most accurate way to determine whether someone is diabetic or not is when we do a blood glucose test or an AGD test, and this can either be through the finger prick or if you're doing formal bloods with your doctor, etc. So some common symptoms include excessive thirst and hunger, frequent urination, blurry vision, fatigue, tiredness, irritability. Sometimes people have slow wound healing, so it means you can have a sore and then it takes a really long time to heal. Some people can have recurrent infections, whether it's a UTI or you're having some vaginal thrush, etc. And some people have some numbness and tingling in the hands and feet. So what happens if you develop diabetes, it is uncontrolled, or you don't know that you consistently have high blood glucose level? You can end up having heart disease, kidney failure, eye damage or blindness, nerve damage, and poor circulation. So obviously that is why we're constantly encouraging people to go for health checkups, so that you just know where your sugar levels are and where your numbers are. I'll speak about the numbers later on. So how do we manage someone who is diabetic? Obviously, diet is important. We need to be having a diet that is low in sugar, refined carbohydrates, and processed foods, because these type of foods help to regulate your blood sugar levels, because you still do need glucose, but having foods that are high in sugar or high in glucose, it causes you to have a sugar spike. And obviously, if you're not producing enough insulin and your body is not able to produce enough insulin, then this sugar spike stays high for consistently long periods of time. We also manage by exercise, by having at least 30 minutes of exercise every single day, hydration, drinking plenty of water, taking your medication if you have been diagnosed, and this can include insulin, monitoring your blood sugar levels, and obviously controlling your stress, because if you are stressed, it causes your body to release glucose, because naturally when your body gets into a stress mode, it means that action needs to happen. And as a result, if action needs to happen, your body will release insulin so that you can do this action. But if you're consistently stressed and you're not putting in any action, then you're consistently going to be having these high sugar levels caused by your stress levels. So what are the normal blood sugar levels that we accept? So if you are fasting, meaning you haven't had a meal, we accept blood sugar levels from 4 to about 6 millimoles. And then after you eat, we're going to expect your sugar levels to be high, so we accept any reading from 7.8. And then obviously after 2 hours, if you're not eating anything, it should slowly go back down until you're back in your ranges of 4 to 5.4. However, if you're someone who is diabetic, your normal ranges will differ depending on how much insulin you're taking, what medication you're taking, etc. And this would be a conversation that you're having with your doctor. Okay, so the next silent killer is what we call hypertension or high blood pressure. So this is a chronically high pressure in your arteries that make your heart work harder to pump blood. Whenever I explain about hypertension, I always like people to think of your arteries as a water pipe. If you're consistently having high pressure in that water pipe, at some point it is going to burst, or you're going to decrease the turgidity of that pipe, because you're consistently trying to push so much water at a high pressure. At some point, that water pipe is going to get weaker. It is the same thing with your blood vessels in your body. If you consistently have high blood pressure and your heart is consistently trying to keep up with this high blood pressure in your body, at some point your blood vessels are going to be damaged. That's why it's important that we want to control our blood pressures. So the ideal ranges of our blood pressure, we have a top number and a bottom number. So the top number in your blood pressure reading is what we call the systolic pressure, and then the bottom number is what we call the diastolic pressure. So ranges that we are happy with, if the top number is between 100 and 130, and the bottom number if it is between 60 and 90. And then if you're anything from 140 and above, which is your top number, then there we start getting worried and we need to intervene. And then obviously anyone who is from 160, I've even seen some patients that are in the 230s. This is a highly dangerous place to be, because obviously if you're consistently having this high blood pressure, at some point one of these blood vessels are going to burst. And if the burst, obviously you are having bleeding, but also it makes you susceptible to have stroke, because imagine if this blood vessel that bursts happens in your brain, you're going to have a stroke. So that's why we want to control our blood pressures. So there's usually two types of hypertensive patients. We have primary hypertension. This is the most common type of hypertension that we have. Usually there's no cause to this, and sometimes it is linked to genetics. Then we have secondary hypertension, and this is linked to other health issues such as kidney disease, pre-pregnancy, which is what we call preeclampsia, which is hypertension in pregnancy, or it can be due to medications that we're taking. And also hypertension can be caused by you having diabetes. So what are some symptoms that you can have if you have high blood pressure? Unfortunately, high blood pressure is just one of those things that are very hard for you to notice by just listening to your body. You need to be consistently having readings, and in most cases you will not have any symptoms that you've got high blood pressure, hence we call it a silent killer. But possible symptoms that you might have is headaches, dizziness, chest pain, vision problems. Some people even have nosebleeds. So what are some risk factors or things that make you more susceptible to developing high blood pressure? We can have your age. Usually those that are over 40, you are more susceptible to developing hypertension. If you're overweight or obese, if you're eating too much salt, if you're not exercising, if you're constantly stressed. Here's the other thing. Stress is going to continually keep coming up. So guys, take note of that. Also, if you're smoking, drinking alcohol, or if you have a family history of someone who has high blood pressure, you're more susceptible. So that's why it's important for us to be having conversations as families to know who had what. So how do we manage hypertension? Obviously, we need to have a low salt diet. So you need to limit things such as your instant noodles, your salty snacks, your tinned foods. Those have a lot of salt because they put a lot of salt to preserve these items. So you need to avoid those. You need to eat more fruits and veggies, drinking water, regular exercise, taking your medications. Even if your blood pressure becomes fine after you taking your medication, please continue taking your medication. You need to avoid smoking or excessively drinking alcohol. And you obviously need to monitor your blood pressure regularly, whether that's buying a blood pressure monitor that you can do at home or going to your doctor frequently. Some common myths that people like to say about blood pressure, I've mentioned one, my blood pressure is fine now. Yes, your blood pressure might be fine, but you still need to consistently take your medication, because if you stop, your high blood pressure will come back out. It will come back. It's only becoming better because you are taking the medication. Another myth is, I feel fine, I don't need to take medication. Yes, you will feel fine, but that's why you need to take your medication. And I know a lot of people don't like taking medication, but that's why it's important for you to be living a healthy lifestyle so that you never have to start taking the medication. Prevention is always better than cure. And the last silent killer that we have is what we call hypercholestremia, or having high cholesterol levels. Hypercholestremia is when you have too much fat, which is what we call the cholesterol in your blood. And there's two types of cholesterols. You've got your LDL, which is your low density lipoprotein. This is what causes the plaque buildup in your arteries. And then you've got your HDL, your high density lipoprotein, which is what removes excess cholesterol from the bloodstream. So when we're looking at your cholesterol numbers, we are usually looking at what we call the total cholesterol, which is your ratio between your bad cholesterol and your good cholesterol. And we usually want you to have your LDL, or your bad cholesterol, to be at less than 100, and your good cholesterol to be more than 60, or you need to have a total cholesterol number of more than less than 200, sorry. So what are some symptoms of having high cholesterol levels? This is another one that usually has no symptoms, hence why it's called a silent killer. And most people only find out after they have a heart attack, they have a stroke, they start having chest pains, or they might even develop angina. And some people even have shortness of breath, etc. So unfortunately, this one you only know if you check your numbers. So what are some complications that come as a result of having high cholesterol levels? So you can have narrowed or blocked arteries, you can have chest pain, heart attacks, strokes, and fatigue. And like I explained with high blood pressure, you need to imagine your blood vessels like a water pipe. If you're constantly putting things inside the water pipe, obviously the pipe is going to become narrower. And when it becomes narrower, that means your blood has difficulty moving through, and as a result the blood pressure is going to increase to counteract this build up that is in your blood vessels, and as a result hypercholesterol levels and high blood pressure go hand in hand, because when you have build up you increase your blood pressure. And unfortunately, when there is high blood pressure and you also have cholesterol, one, you're increasing the pressure in your blood vessels, they can burst, or the plaque buildup in your blood vessels can actually break off, and these can move through your bloodstream and they can block the small arteries that you can have, and this is what we call an embolism. And if you block the small blood vessels, these small blood vessels can be going to important body parts. For example, in your heart, you have small blood vessels. If those are blocked, that can lead you to having a heart attack. If you're blocking small blood vessels in your brain, this can increase your chances of having stroke, bleeding, etc. So all these silent killers, they go hand in hand. For example, if you've got consistently high blood sugar levels in your bloodstream, these blood vessels, you sort of need to imagine these glucose that's moving in your bloodstream, you sort of need to imagine them as razor blades. They damage your blood vessels. So as you can see, all these things will play a role in damaging your blood vessels, and your blood vessels are very important. But anyway, moving on. So how do we manage your high cholesterol levels? Obviously through diet, eating less red meat, less full fat dairy, fried foods, and eating more of your oats, your fish, your nuts, your olive oil, and also obviously regular exercise, taking your medication as prescribed. If you're someone who's a smoker, you need to stop smoking, and you need to manage stress. So all in all, you can see that these chronic conditions are linked to each other, and one of the major links between them is your diet, your exercise, and your stress. And those are all things that are within our control. We play a big part in affecting those things. So it's important that we're doing our best to make sure that our diets are clean, making sure that we're taking part in some physical activity, and managing our stress, because all three of these things can increase our chances of developing these silent killers. And unfortunately, some of us are walking around with these illnesses, and we never know when one day it's going to come at you and something serious is going to happen. So it's very important that we are taking our active part in preventing those chronic illnesses from developing. Okay, so couples often mirror each other's lifestyle habits, from the way we speak, the way we act, the way we dress, what we eat, what sexual or physical behaviors we exhibit, and sometimes even chronic illnesses can be influenced from one partner to another. Hence, we usually say that if there's a chronic in the family, usually it will affect the other partner, because usually illnesses run in the family. But before I discuss the deep implications that come with us influencing each other as partners, I just want to discuss about direct and tangible ways that our partner affects our health. So the first one is sexual health risks. Obviously, when one partner is affected by one sexual transmitted illness or infection, it's going to affect another partner. For example, STIs like HIV, herpes, HPV, etc. These are transmitted between partners. And unfortunately, HPV is mostly commonly passed from men, which are usually can be affected by the HPV virus, but usually they don't show symptoms, compared to women who are more likely to show symptoms as a result of being affected by this HPV virus, and this can lead to cervical cancer in women. So as a result, as partners, we need to be aware that if one partner is affected by an STI, we need to be aware that it can have a bigger implication on the other partner and vice versa. Another way that our partners directly affect us is a man's health before pregnancy can affect the mother and baby's health. There has been studies that show that when there is obesity, high blood pressure, when the male partner is smoking or involved in any unhealthy habits, those habits are directly translated to the unborn child. So I know in most cases we like to put the responsibility of the growth or the health of the baby on the woman because she is the one who is carrying the child. But it is also very important for us to take note that the paternal health or the health of the father plays a big influence in the health of the unborn child, and their habits can actually be translated to the child, and these children can be born with either genetic disorders or they can have other illnesses or other difficulty in the growth of this pregnancy. So it's very important knowing that when you're choosing to build a life with someone, to bear children together, the responsibility does not always bear on the woman who is going to be carrying the child. Yes, the woman has a big responsibility because she is carrying the child for 9 months, but the makeup of this child is going to be highly affected by the paternal health. Then the other way that your partner's health directly affects the partner is when one partner is dealing with a mental health crisis or a mental health issue, whether that is anxiety, depression, personality disorders, etc. Those can affect the other partner because obviously the other partner will have to take an active role in taking care of the partner that is affected with the mental health, and we can reach a point where the one partner is burnt out from taking this emotional and physical role of taking care of the partner that is affected by this mental health crisis. Okay, yeah, it became too much multitasking, trying to record for my meeting and for YouTube at the same time. So I'm done with my meeting on WhatsApp. WhatsApp meetings are so weird because it just feels like you're just speaking to people. Okay, I mean, I guess it's the same thing that I do on YouTube. But like, it was so quiet, and then eventually got a little bit busy, then it went quiet again. But yeah, anyway, I'm rambling. So where I'd left off is obviously I wanted now to get into the influences that we have on each other as partners. So as partners, obviously we mirror each other's health habits, or we mimic each other's health habits, and this can be good or bad. So that's why we say in most cases when there's a chronic illness with one partner, we usually like to also just watch it with the other partner, because in most cases chronic illnesses will run in couples. When one has it, in most cases the other one will have it. And the reason for that is obviously when this one partner develops this chronic condition within the relationship, it means that there is somehow unhealthy habits that are happening within this relationship that has caused us to get to this point. But obviously if the partner came in with a chronic condition, then it's still more likely to influence other one to get into it. Because if the partner that is affected with a chronic condition, for example diabetes, if they're still eating unhealthily and the other partner is also eating unhealthy with them, well, in turn other partner will eventually develop it. But I'm not saying it's like 100% yes it will happen, but there's a high likelihood that it will happen. So before I go into depth regarding the influences and how they affect us as partners, I just want to discuss about some illnesses that directly affect the one partner to the other, or things that are directly linked from one partner to the other. And then the other thing that affects the other partner in a health is obviously if you're in an unhealthy relationship. And this can either be in an abusive relationship or a toxic relationship. Obviously, if it's an abusive relationship, the partner that is a victim, they are getting heavily influenced or they're heavily affected by this relationship. But also, if the relationship is toxic, you guys are unhealthy, you guys are constantly fighting, it's going to affect you guys' mental health status, you guys are constantly going to be stressed, etc. There's studies that show that when partners are in a healthy relationship, they live longer, they're happier, they're less lonely, they have less stress, etc. So when the opposite happens, obviously you're going to be heavily affected. So these are just a few examples that I just wanted to show you of how our partner's health heavily affects us and vice versa. There's so much happening. I forgot to press the audio recording. I'm sorry if the audio is going to be a little different, but I'm too tired to go back and do it all. But yeah, anyway. So when I met my partner, this was during COVID, and this man was running. He was doing 10-20 kilometers, and I just thought it was so unnatural for any human to be running like 2-3 hours on end. So he was like, no babes, you can just start small, wada. And obviously it was COVID. I just wanted to get out of the house, so I started running. Cool. So you start small, 1 kilometer, 2 kilometer, 2.5, 5 kilometers. Okay. You see, you are gaining momentum. Eventually, I was there running 10 kilometers more. Girl was almost doing half marathons at some point in her life. And this was just to show the power of influence of your partner. So as much as that is a positive influence, the reverse can also be true, where your partner influences you in a negative way. So obviously that was a positive influence that my partner had on me and my lifestyle, etc. So I want to go more in depth into those positive influences that our partners can have on us. So firstly is, if you're in a healthy relationship, studies show that you are less lonely, you have less anxiety, and you live longer. And that is why when you're in a relationship, people will give you statements like, oh my gosh, you're glowing these days. There's just something about you. And that is just evidence to show that when you're in a healthy, happy relationship, it's going to affect you in a positive light. And like I mentioned, your diabetes, your high blood pressure, and your cholesterol, they are all heavily influenced, or one major risk factor for all of them is stress. Obviously, if you're in a healthy relationship and there's less stress, you're less likely to develop our silent killers. The other thing is, if you get in a relationship with a partner who's going on a health journey and you do it together, you're more likely to be more successful than someone who's doing it alone. There was actually a study where couples and individuals, and they were told to start this workout plan or this workout regimen. And in this study, after 12 months, it showed that only 6.3% of couples dropped out compared to 43% of individuals. So you're more likely to stick it out in any healthy routine when you're doing it with a partner. And we see this whether you're doing it in a friendship or whether you're doing a group work, etc. You just need that camaraderie, and you just need that support and that accountability that you get from your partner to say, hey, let's continue doing this. When it gets difficult, when you want to quit, you guys are always keeping each other accountable, like yeah, we need to be doing this, here we need to be doing that. So that is one of the benefits that come one of the positive influences that come with being with a partner. Then obviously, when you're with a partner who prioritizes their health, you will see that partners that are very much into self-care, you see all of a sudden their husbands are also putting on these face masks, their husbands are going for massages, the husbands are also going for manicures, etc. This is influence of usually the woman in the relationship, and that is a good thing. So when one partner prioritizes their health, the other partner says in it like, yeah, I like that, okay, let me also try it. And then it starts more like that, okay, my wife does this, okay, let me also try it. That's why you see in any relationship, you will see a guy all of a sudden starts dressing better because the wife is involved, or the guy all of a sudden he also starts going for manicures, or the guy all of a sudden he starts buying a certain brand of cool drink because other partner is doing it. We all get influenced, or we all mimic the habits of our partners, and it's not a bad thing as long as the habits and the behaviors that we're mimicking are positive and they're helping us on our health journey. So here's just a few practical tips for couples, whether it's a romantic relationship or it's just a friendship relationship and you guys just want to assist each other. This is the best way to go about it. First of all, you guys need to get screened together. You guys need to know where you are starting off. If you're going to be going on any health journey, you want to lose weight, you want to get into running, you want to start eating healthy, you want to stop eating sugar, or you just want to manage your chronic conditions. If you both get screened and you know your numbers, you know where you're starting from, there's no point in you getting into a health journey and you don't know what changes or what difference has been made. Yes, you will see it physically in your body if you're getting into like a running or an exercise regimen, sure, but it's also important for you to get your numbers. What are your cholesterol numbers looking like? What is your blood pressure numbers looking like? What's your diabetes or your blood sugar levels looking like? Guys, let's go out there and get numbers for do we know our blood types and things like that. Let us get screened so that we know these things. And when it comes to getting screened, guys, let us also, if we have the means, to also get genetic screening. Guys, we need to know these things. I feel like we're so willy-nilly when it comes to getting into relationships, and we don't know what type of relationships we're getting into with these people health-wise. I think it's very important for us to get to know our genetic numbers. Just saying. Then the next thing is obviously team up for health. If you're going to get on a health journey, I would highly advise that you do it with your partner. Yes, your partner does not have to be doing directly something that you're doing with, but if your partner can just support you on that journey. So let's say, for example, your husband was already healthy, was a gym freak or whatever, and then you now as a girlfriend or the wife, you now decide like, you know what, I also want to start gymming, I want to start looking good. Your partner is already involved. Sure, you can go to the gym together, but obviously your fitness levels are going to be different. But the healthier partner can support the other one and say, okay, this is what you can do. Okay, these are the supplements that you can take. Okay, this is the workout regimen that you can follow. Okay, here's a cute outfit that you can take to the gym with. Okay, I'll go and drop you off at the gym. When you feel and you know your partner is supporting you in a health journey that you're going on, even if that partner is not directly involved in it, but just knowing that they are supporting you and they are there for you, trust me, it does wonders to your mental health, and it just gives you that boost of energy, like, okay, someone actually believes in what I'm doing. And that is all that we want when we're going on health journeys, is that someone is rooting for us. And if you can get that from your partner, that is amazing. And obviously, if you can do it together, that is even better. There's a couple that we have at our work. Either every morning or in the after or in the evenings, I'll see them either going running together or they're going for walks together. And it's such beautiful to watch, especially when you're just watching them from afar. They just look like they're having the time of their life. You know, they are laughing together. You know, it's just like you can create a moment together with the person that you are with. So it's very important that you team up for health. Then the other thing is we need to talk about health more openly. I feel like in most cases, when it comes to our health journeys, it's made like a personal thing. Like, oh, okay, you're the one who wants to go on this health journey, do it by yourself. Or even someone who he has a chronic condition, then that chronic condition is just made be like, okay, you sort out your chronic condition because you have it. Let us be more open and talking about our health. Okay, what are you struggling with? Okay, what mental issues do you have? Okay, what health issues do you have? How can I assist you? Okay, then you guys get to understand what you're both suffering with, because your partner cannot assist you if they don't know what they're getting themselves into. So it's important for us to be having these conversations. I've seen so many couples, especially old couples, that come into the hospital, especially the old ladies. They will know every detail about their husband's medical history. He had the operation in 1992, then in 87 he had a prostate. Like, they would tell you everything. If the roles are reversed, the husbands know nothing. They know nothing about their partner. So it's important for us to talk more openly, especially I would highly suggest for partners where one partner is HIV positive and the other one is not. I have seen way too many couples that do not want to disclose to each other about their status. Obviously, it's important for you to disclose, but even if you've disclosed, you guys still need to talk about the challenges that you're facing, what treatment the other partner has to be on, what are the side effects that come with this partner taking this medication, etc. Let's just be more open about talking about our health. And then obviously the next thing is we need to look out for each other. If you know that your partner is dealing with a certain chronic condition, diabetes, high blood pressure, cholesterol, etc., and whatever habit that they're involved in, it's going against them becoming healthier, you need to speak out and say, okay, look, husband, this is not working, or this habit that you're doing is very unhealthy for you and it is going to derail you on your health journey. Actually, when I was doing my presentation, there was my mom actually asked about couples that have one partner who becomes so unhealthy to a point where they are unable to take care of themselves. And in healthcare, unfortunately, we see this so many times where it's either the husband or the wife, they've either become so obese or their health journey has deteriorated so much that they are now a full care patient. And when this happens, you become a burden on the partner that is healthy, because they have to take care of you, they have to feed you, they have to take you to appointments. It also becomes now a financial burden of sponsoring the health bills of the partner that is unhealthy. And in most cases, I've seen where couples will come drop off their partner in the hospital and they leave them there. And then when it's time for this partner to be discharged, the partner that's at home, they will tell you so many stories of why they can't come fetch this person. And the reason why that happens is because they are so tired, they're exhausted, they are worn out taking care of their partner. So when you see your partner is developing an unhealthy habit, you need to nip it in the bud before it becomes worse. I know sometimes we are nervous or we are scared to tell our partners the truth. Like, no, babe, if you continue eating like that, you really are going to become obese. Or no, babe, you should not be eating that because you are affected with high blood pressure. This is going to go wrong. Or no, babe, you should not be defaulting on your medication because if you do 1, 2, 3, and 4 is going to happen. Let us start being honest and looking out for our partners and saying, hey, this road that you're going down, it's not okay and it is going to go very south for you. And I know they're going to hate you, they're going to feel very frustrated with you when you say it, but rather do that than your partner becoming a burden for you later on in life. I've also seen it with kids where their parents have gone down this path of not taking care of their health when they're able to. Then they get to this point where they are now in very bad condition. Their health has deteriorated so much, and the kids, they become overburdened. They have their own families to take care of. So the parents, they get dumped in the hospital, they get dumped in the old age homes, or there's a carer who comes and takes care of the parents, and the kids are just sending money because they're just so exhausted and they're tired. So let us not become burdens to our partners, to our children, etc. Let us take care of our health. And if you see your partner is going down the wrong path, do not be scared to tell them like, hey, we are going down the wrong path over here. Okay, then the other thing is, I think I already mentioned it when I was talking on openly about health, but we also need to take an honest interest in each other's health, especially when it comes to partners that are intimate. I've seen so many husbands that do not know their partner's menstrual cycle. They do not know what birth control their partner is taking. They do not know when last they had a period, what symptoms they get when they're period. They don't know how to take care of the partner when their partner is going through all this emotional turmoil that comes with you having your period. And it is time for us to stop that. Yes, I know it's your responsibility as a woman. You've had your uterus for however many years. You know how to handle it. But when it comes to a point where your partner cannot do it anymore, or your partner is just, they're just tired, guys. I know, as much as I've had periods for 25 years, but every time it still comes, just like, what the hell, uterus? Like, do we have to go through this again? The pain, the emotional turmoil that you're going through, etc. Let us take an interest in our partner, our girlfriends, our wives, etc. into the menstrual struggle, especially for couples that are trying for a baby. You need to know what the window is where you're supposed to be getting down and dirty to make sure that baby comes. Or if you're doing the opposite and you're trying to prevent getting pregnant, you need to know what window you should be avoiding. Also, if your partner's on birth control, you need to know the side effects that come with taking these birth control. It affects their libido. It affects their sexual needs. It affects the, what's the proper way, or the proper terminology? It affects how nice it is down there for them. So if you do not know what birth control they're on, how are you going to know? Also, if your partner is got a mental condition, a chronic condition, you need to know what medication they're on, what are the side effects, how often they're supposed to be taking it. We just need to take an interest in each other, and we need to know our partner's health journeys. Okay, then in conclusion, the whole point why I wanted to speak about this, especially to the couples, because that was the group that I was asked to speak about, is I want us to realize that as couples, our health journeys are interconnected one way or another, in a good way or in a bad way. As a result, we need to be cognizant of that, and we need to realize that on this health journey, we are health partners. As a result, as partners, we need to help each other. So as much as we're going through life struggles, we're going through life in general together as a couple, as friends, etc., we are going to affect each other. As a result, let us make sure that the influence that we're having with each other is in a positive light. And if we realize that, we'll be able to better assist each other. I want us all to live good and healthy lives. As much as I'm a healthcare worker, as my audience, I don't want to see any of you in the hospital. I want you guys to be living your best and healthy life. And you need to be aware that the people that you're spending time with, the people that you live with, the people that you are dating, the people that you are married to, they heavily affect how your health journey goes. As a result, if you are aware of that, you can put in the necessary steps that you need to be able to make sure that your journey goes smoothly. But also, if you do have a chronic condition, or your partner has a chronic condition, then you can become a source of strength for your partner as they're going through this journey, as they're managing their health. There's a proverb that they say that a problem shared is a problem halved. So let us not go through this health journey. Let us not suffer through all these different health conditions alone. That's why our partners are there to go through life. We want to live and grow all together. But don't leave your partner behind and you are growing old and in your best shape of your life, and your partner is there struggling. Come on, let us help each other. So yeah, that is pretty much all from me. That was the conversation that I had with my group at church. One of the other interesting comments that one of them mentioned was how our relationships can be a source of hypertension, which is very true. If you're in a very stressful relationship, it definitely can increase your chances of developing high blood pressure. And the other thing that she mentioned is that, let me actually read it. how she phrased it. I thought it was a beautiful question. How can couples navigate chronic stress? I believe we all have stresses for fees, rent, etc. Emotional suppression is very high. And that is very true. Most of us, we're very good at hiding the stress that we have, even in a partnership. And my advice to her and to you guys is you need to share. Like, that's the best thing that you can do, is you need to share. Because I feel in most cases we feel like this problem is just me who's dealing with, or it's only me who's thinking about it. And in most cases, your partner is also feeling the exact same feelings, if not even worse. So as a result, if you share and you talk about it, say, hey, babe, this is what's stressing me out, whether it's that rent, whether it's those fees, or whether it's school, whatever you're going through, if you speak about it, they'll be able to understand where you're coming from, but also you guys will be able to take stock together, like, okay, so this one is feeling like this. Okay, so you guys need to schedule those emotional check-ins. Like me and my husband, we have a meeting every quarter and we're just checking in. Hey, how are you doing? Okay, within our relationship, how do you think we're doing? And then we do other checks, finances and things like that. But just having that regular check-in, like, hey, what's up? And we all know our partner's signs and symptoms. Like, there's days where, like, this one is stressed out, and then you can step in. But even if your partner does not say something, but at least if you guys speak about it, then they know that you're not alone. And also, if there is something that you both are stressed about, if you guys create a plan on how to resolve that issue, then you're less likely going to feel like you're tackling this thing on your own. Because I think that's the problem that most of us have, is when you have this problem and you're not speaking about it, then it feels like it's just you against that problem, where it's the both of you against the problem. So don't isolate yourself. I know it's very hard to go to someone and say, hey, I'm struggling. Myself, I find it very difficult. In most cases, it gets to the point where I'm just crying, and then my husband is like, why are you crying? I'm like, this and this and this is happening. He's like, why did you let it go for so long? So if you can just schedule a time where you have to speak about what's happening, it helps, especially as introverts who have difficulty expressing our feelings. Just for you guys, the moment, like, hey, let's talk about this, and then put a plan in place so that you know who's responsible for what, and you can share the burden. Okay, so this was a nice chat. It was very informal. It's not as formal as my other videos, but yeah, I just thought that the meeting that I was having was a good conversation for you guys to get into, and you guys can just realize the influence that your partners have on you. So since this was a church conversation, I will leave you with a scripture. Where is that verse now? Okay, so the verse is coming from 3 John chapter 1 verse 2. Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. I wish you guys good health, and I hope you guys will share this with your partners so that they can be aware of how much influence they have on your health, and also how much you influence your partner. And comment down below and let me know, what is something that you have started doing as a result of your partner, or what has something your partner has started doing as a result of something that you do? I'll be very interested to know what that thing is. For me, I already told you guys about the running, but the other thing is I love speckled eggs. Like, whenever I go to any picnic, whatever, people know I will bring speckled eggs. And as a result, my husband is now obsessed with speckled eggs. Like, whenever we pass by the engine, he will find a speckled egg. So what has your partner started doing because of you? Whether good or bad, let me know down in the comments below. Until whenever the next video is. Bye, guys.